Hello, YouTube world. Welcome back to another edition of the live question and answer session with me, Miss Patty from 4-Year CNA, where we're here to answer your questions about the test, CNA training, CNA work environments, or any other topic related to nursing assistants that you guys have. While we wait for people to join us today, when you join, just send me a little hello or a thumbs up to let me know that you guys are here. I'm going to pull the chat over so I can see your questions. And we'll go ahead and get started. While I'm waiting for you guys to show up, we have, oops, messed up there. Hi, Monia. Hi, Monia or Monia. I'm not sure how to say that. Hi, thanks for joining us. So while we're waiting for people to come in, I do want to talk about something that happened, made national news this week. Hi, Ramses. Thanks for coming. We had a series of tornadoes that went through last week and took out a lot of buildings and a lot of things up in the Midwest, particularly Arkansas and Kentucky. We had a couple of nursing homes and acute care facilities that got affected by this. And I wanted to spend just a couple of minutes talking about this because it really is kind of a pretty important topic. Hi, Fatal. I hope I'm saying that right. Hi, Maria. Thanks for joining us. So, when you're in training, CNA training, you have to go over emergency processes. It's probably going to be in your textbook. You probably have a couple questions on it. And during the test, you're going to have some questions on how to respond to emergencies, particularly fire emergency or evacuations. These are extremely important topics. Hi, Stella. Hi, Cynthia. Thanks for coming. These are really, really important topics because if you're in the middle of a tornado, similar to what happened last week, right? Can you imagine you're at work, you're going about your normal daily routine, handing patients ice water or taking somebody to the bathroom or just your normal daily activities. And all of a sudden, somebody comes running in and says, "Oh my gosh, there's a tornado headed this way." Now you look around and you've got 60 residents in this building that are not able to save themselves. So a handful of staff, maybe 10 people, have to save all of these residents, and you've got to do it that quick. You don't have time to go running to the policies and procedure manual to figure out, okay, what are we supposed to do? There's no time for that. You have to be able to act, not think. You don't have thinking time in an emergency. So this is why this is such an important topic in training, but also in testing. And this is something that a lot of people don't really understand, is that on the state exam, there are a few questions that are considered critical concept questions that you have to get right. Or at the very least that you don't choose the wrong answer. And that gets a little bit confusing. So normally when you have normal questions on the test, the written test, normal questions are you have a right answer and you have 3 wrong answers. And if you choose the right answer, you get credit. If you choose any of the wrong answers, you just don't get credit and you move on. So in most testing questions, it's simply you get credit for right answers and that's it. But there are a few questions that fall into a totally different category, and those are called critical concept questions. So a critical concept question is going to have a right answer just like the others, and it'll have a couple wrong answers just like the others that won't really count against you. You'll get credit if you get the right answer, no credit if you don't choose, if you choose one of the other wrong answers, but there's going to be one answer there that if you choose that, it would actively put a patient's life in jeopardy. And that answer triggers a degradation of the test. So if you choose the right answer, you get credit just like everything else. If you choose one of the other wrong answers, It's just not going to give you credit. If you choose this really wrong answer that puts somebody's life at risk, that one answer could cause you to fail the written test, because in an emergency, we don't have time to train or to think or to look things up. So we really have to understand emergency processes. And thankfully, the individuals in these facilities that were affected by the tornadoes, they knew what to do, and they kept the patients safe. And even though they sustained direct hits from seriously horrible tornadoes, in one nursing home, there was only one fatality, and it could have been way, way, way worse. So it's really important that we understand that we are the only thing standing between this patient and whatever's out to get them. So we really have to understand our role as the protector in that situation and make sure that we truly understand the processes that are required to keep the patient safe. So if you're already working as a CNA and you don't know how to react in an emergency, I would strongly suggest that over the next couple of days, you go to your policy and procedure manual and that you review those policies to make sure that you know what to do in the event of severe weather, of a fire, of a catastrophic mass casualty situation. You need to know how to react in an emergency before the emergency happens. And that's how we keep each other and our patients safe. So if you don't know your emergency processes, if you kind of skipped over them in school and you got lucky on the test, make sure you take a couple minutes to review that, because next week it might be your patients that are relying on you. None of those CNAs or nurses in those facilities expected this when they went to work that night. They had no idea. So we all have to be ready for an emergency at any time. So make sure that you brush up on those emergency policies and procedures. And if you don't know, the emergency for fire is universal across the country. It's RACE: rescue, alarm, contain, and extinguish. So we always move the patients out of the area of the fire to a safe location. We let somebody know that there's a fire. We close the doors to try to contain the fire in one spot. And then if it's small enough and you feel competent, you can try to extinguish it with a fire extinguisher if you've been trained. But you need to know that RACE. So if there's a fire, it's always, always, always rescue, alarm, contain, extinguish. They may use different words, but it's the same process. So brush up on that as well. So let's see who else is here. Stella, hi. Cynthia, hello. Gerline says, hi, Nurse Patty. Hi. Cynthia says, testing tomorrow in Oregon. Oh, that's so exciting. I know you're probably a bundle of nerves and you probably won't sleep much tonight. But if you can remember, it's all about the patient. So whatever you do during the test, try to focus on the patient. Does the patient look comfortable? Is the patient exposed? Is the patient in the center of the bed? If that were your mom in the bed, how would you want them treated? Does the patient truly understand what you're about to do? If you concentrate on that patient, Cynthia, you will be fine on the test. Okay. Jennifer, hi. Thanks for joining us again. Cynthia says, thanks for all the help getting ready for my test. Oh, that's why we're here. We are so happy to be part of your journey. Thank you for letting us be part of your journey. Marley, hello. Jennifer says, just started a CNA position, been doing it 4 months, and I'm finding it hard. Giving report to the next shift is the hardest. Keeping up on the status of all the patients while you're busy is hard. Yeah, Jennifer, it's not an easy job. You're absolutely right. But can I give you a little tip on getting and giving report? Okay, so this might actually help you. Okay, so this is the quickest way for CNAs to give and get report when you're coming on a shift or going off. And I know it's backwards on the camera, but it's TEAMS. It's called the TEAMS report. So if you have a sheet of paper and you've got 10 patients, just write, for all 10, TEAMS. T is for toileting. You have to know how your patients toilet. Do they go to the bathroom by themselves? That's bathroom privileges. Do they need some help to go to the bathroom? That's bathroom with assist. Do they use a bedside commode, either with or without help? Do they use a bedpan? Do they have a catheter, or are they incontinent? So there's only a few choices here for toileting. So the first thing you need to know is toileting, because every patient's going to have to go on your shift. No doubt about it. You have to know toileting. That's first thing. E is for eating. Same thing. Everybody's going to eat on your shift. Even if you're working overnights, you need to know what the diet restrictions are for the patient, because they may want a snack at 1 a.m. and you need to know what their diet is. So E is for eating. Do they need their liquids thickened? Do they need a special diet? Do they need assistance with meals? Do they only eat their big meal in the afternoon, not at night? Those types of things. A is for ADLs. So even though toileting and eating are part of ADLs, we kind of address those separately because they're biggies. Everyone's going to have to go to the bathroom on your shift, and everybody is going to have to eat or drink on your shift. So those two we pull out separately, T and E, toileting, eating. A is for all other ADLs, dressing, bathing, grooming, that type of thing. M is for mobility. And this is a big one. You need to know the mobility restrictions for your patients. Are they restricted to bed? Does the head of the bed need to stay up for 45 minutes after a medication is given? Does the patient need help getting to the activities or dining room? What is the mobility? And then you have special. So TEAMS, toileting, eating, ADLs, mobility, and special. Special would be things like vital signs every 4 hours. Podiatrist is coming in today, scheduled for an MRI this afternoon, that type of thing. So, things that you need to, special things that aren't covered in the other categories. That quick and easy way of giving and getting report covers all aspects of CNA work, TEAMS. And if you can remember that, TEAMS, it will simplify your report down to like 10 minutes. So it's really, really helpful. So let's see here. Mary Booberry. I like that. That's a cute name. Took my test today. Please send good vibes. Oh, so you must be waiting on your results. Oh, Mary, we're going to keep our fingers crossed for you. I'm sure you did fine. But come back and let us know how you did so we can congratulate you. And Cynthia's sending positive vibes your way. Awesome. Jennifer says, I live in Oregon too. I failed it the first time, went to Salem and had better luck. I found Salem to be a little more laid back. Yeah, unfortunately, the vibe in some testing centers is a little different than others. They do try to regulate them and make them as uniform as possible, but people are people. So Cynthia's going to take yours and bend. So we're going to keep our fingers crossed. And Mary says, would you recommend Teams also for ICU? Yes, absolutely. Teams is specific to CNA. It does not work for nurses. Nurses have a whole different ball game. But for CNAs, these are the things you need to know about the patients. So you're going to need to know, how do they toilet? If they're in ICU, chances are they're probably either catheterized, incontinent, or in some rare cases, they may have a bedside commode. But chances are they're going to need a higher level of care because they're in the ICU. Same thing with eating. They may very well have a feeding tube, or they may be receiving IV nutrition, what we call TPN. So that means that they're probably not taking much by mouth. Well, if they're not taking much by mouth, then we definitely need to focus on mouth care, because that mouth can dry out if you're not taking fluids through it. So the Teams can also be a very valuable tool to you, even in the ICU, because the CNA aspect of care is the same. It doesn't matter where you are. CNAs help with ADLs. Now, in the ICU, you may have a little bit more to write under special because these patients are more critically ill. That's the whole purpose of ICU. They're more critically ill. So you may have things like report O2 sats below 90, or, the patient is on a vent, which means they're not going to get out of bed. So you may have a little bit more to write down in the special tab, but those 5 things are what CNAs need to focus on to do their job, TEAMS. So I hope that helps you with that. So, but yeah, the TEAMS report is a very valuable tool as a CNA. Now, there's a couple things that came up on my channel this week, and I wanted to talk about 2 questions that were asked on my channel. The first came from Lillian Obiki, who I guess failed one section of the CNA exam and wanted to know what do they do, to be able to retest. So I want to talk about the retesting process. Ideally, you wouldn't need it, right? So ideally, you pass the test the first time and you don't have to worry about it. But sometimes things happen and you find yourself failing one part of the CNA state exam. So in most states, you have to retake the part that you failed. So let's say you passed the written and you failed the skills. It happens. Well, you would only have to retake the skills part. Okay, so you're going to retake the part that you failed. In most states, you have to wait 30 days between attempts. That doesn't mean you have to wait 30 days to register. It means you have to wait 30 days between attempts. So if you fail today, okay, you can register tomorrow, but you wouldn't be able to test until after January 17th. Okay, so they would schedule your test, your second attempt, after that date. So not all states follow this. Some states only give tests on very specific times. So you would have to register for that, whatever date it is that they're offering the test. But for the most part, most states are a 30-day waiting period between. In most states, you have 3 attempts to pass both sections within a 2-year period. Now, this is pretty consistent across the board. So 3 attempts to pass both sections within 2 years. So let's say, like Lillian took the test in August and has to retake a portion of it. Well, she can register at any time to be able to retake the portion that she was unsuccessful at, the portion that she failed. And once she retests, if she passes, then she is then a CNA. If for some reason she doesn't pass, then she's got to wait another 30 days to retest again for that particular section. And if she's unsuccessful that time, then she would need to go back to school and take another state-approved CNA training program to be eligible to test. Now, this is pretty much across the board the way most states structure this. So you have 3 attempts in 2 years. Now, let's say that Lillian took the test back in August. She doesn't retest. 2 years go by. Now she's got to start from scratch again, which means that she would need to attend classes if she's in any state but Florida. Remember, Florida allows you to challenge. So Florida is a little unique. In Florida, you don't have to go to school to take the CNA state exam. Every other state requires training. So if you do not pass both sections within 2 years, you have to start all over again. Okay, I hope that helps. Let me get a drink here real quick. Okay, so let's see here. Oh, wow, I didn't know that, Mary. Mary says 3 attempts. I'm in Arizona and we get unlimited attempts in 2 years. So that's good to know. I was not aware of that. Carol says, hey, do you offer online CNA for African countries? No, unfortunately, I don't. I'm so sorry. We don't offer certification for anybody. All I do is offer training that helps people gain the skills they need to be able to pass the CNA state exam. But the state exam, the certification is actually done by the state. All we do is help with training and remediation. So I hope that helps. Cynthia says Oregon is unlimited attempts in 1 year. Oh, that's interesting. Very interesting. Marley says, what happens if you don't take it in 30 days? Well, it's 3 attempts within 2 years. So let's say like Lillian, she took it in August. If she doesn't re-register until February, that's certainly okay because she's got 2 years to pass that second attempt or third attempt. Jennifer says, in Oregon, you can test all you want, but you only have a year. You can take it 20 times if you need to. Now that's interesting, Jennifer. I did not know that, and I'll have to look into that. That's very, very, very interesting. Definitely takes some of the pressure off, doesn't it? So, Jesus says, what about if you have a patient in the hospital tested positive and you're not vaccinated? Should I tell someone else to treat that patient? This is a very interesting question, Jesus. And this is, how do I put this? This is a very real concern. Okay. So, and I want to kind of get you to look at this from a slightly different point of view. Okay. So let's say that we have a patient A, who is COVID positive and you're not vaccinated and you're assigned to care for patient A. Now, as a CNA, you're saying when you report for work that I'm here, I'm available to help wherever I am needed as part of my working relationship, right? So as a CNA, we don't really get to pick and choose who we want to take care of. So you're saying by being there, I'm good to go. I'm ready and willing and able to do whatever it is that you need me as the employer that you need me to do. So you go in and you take care of patient A. And because you're unvaccinated, you contract COVID. Now, chances are you're not going to have symptoms for a little while. And you're going to take care of other patients tomorrow and the next day and the next day. Even though you have contracted COVID, you probably don't know it yet, which means that you're going to unwittingly expose all of these other people to a virus. Now, remember those patients, patient B, C, D, and E that you take care of in the next couple of days, they're sick. They're sick with something else. Maybe they had a heart attack, or maybe they're having surgery, or maybe they're having a diabetic crisis. But whatever's happening with them, their immune system is already pretty busy. In fact, it's so busy they can't really handle it on their own. And that's why they're here for some extra help. So their immune system isn't quite cutting it. That's why they're in a facility. So if you, who has now contracted COVID, are caring for those patients and unwittingly passing that virus on to other people, and you don't mean to, you didn't do this on purpose, but nevertheless you did, those patients may not have the immune system. Remember, their immune system's already struggling, fighting off whatever it is that they've got going on. So if they're unable to fight this off, it could very, very seriously affect them. This is why a lot of places feel that their caregivers need to be vaccinated to try to prevent that cross-contamination from patient to caregiver to other patients. And when we think about the patients themselves and how they are already immune compromised, it does seem like that might be a pretty logical thing to do, right? Especially if those patients, patient B, C, D, and E, especially if they're so sick already that they can't be vaccinated. And that's what a lot of these policies are written for. In healthcare, we have to remember that that was a choice we made to go into healthcare. And that choice means that we are there to put the patient's needs um, in front of our own at times. So I hope that kind of helps. But no, you really, your question is, should you tell someone else to treat that patient? No, because by virtue of you being there, you're saying, I am ready, willing, and able to take on the patient assignment that the facility needs me to cover, right? So you can certainly talk to your supervisor and say, hey, I'm not vaccinated. I have some concerns. But at the end of the day, we have patients there that need care. We're paying you. So you need to be able to provide that care. And that's really kind of what the whole system is all about, is patients that are, or people that are more able-bodied are there to take care of those that are less able-bodied. That's the whole purpose of the healthcare system. So Jennifer says you just have to pay every time you take it. LOL. Yeah, I would imagine they don't do it for free. Yeah. It just changed in Oregon about 3 years ago. It used to be 3 attempts in a 2-year period, not now. Well, that's good to know, Jennifer. Like I said, I'll definitely look into that they changed to unlimited from that 3 attempt system. And Suzette says, hello. Hi, Suzette. So one more thing I want to talk about today. And this came from MPAM. Now, this is kind of a strange situation. So I want to give you a little bit of background on this. My videos that are online, most of you guys are familiar with all of my skills videos. And this is how we're generally found, right? You're online searching for how to do catheter care, and I show up. So those videos that you see online are based on Prometric testing scenarios, right? Prometric testing scenarios. So these are the testing scenarios right here. They're uniform across all Prometric states. So if you are in Texas, or if you're in Florida, or if you're in Connecticut, or if you're in New York, you would get one of these 11 testing sets. And they all say exactly the same thing. Other states are a little bit different, but they're very uniform across Prometric. But understand that what I'm showing you on these videos is a demonstration based on this particular patient, this one patient right here, this guy right here. This is what he can and cannot do, and this is what they need help with. Okay, so it's very, very specific. Now, MPAM put a comment on our YouTube channel that on the video, the patient is giving too much assistance, and she wanted instruction on how to transfer somebody. This is transferring from bed to wheelchair. That had no mobility at all. So I want to talk about this really quick, because she's not the only one that has left comments like this on my website or on my videos. And I wanted to address this. So understand that every single patient is going to be different. Everyone. So if you've got a stroke patient here and a stroke patient here and a stroke patient here, they're all going to need to be transferred slightly differently, because they're all going to have a different level of impairment. It's not exactly the same. Not all diabetic patients need the exact same care. Not all stroke patients need the exact same care. Everybody is affected by conditions a little bit differently. So let's go back to COVID for a second. Some people with COVID are able to go to sleep, in their own home. They cough a little bit. They can't smell anything. They can't taste anything. But 3 days later, they're back playing tennis, right? Very mild impairment. Other people have to go to the hospital. They get put on vents. They're intubated. They're in there for 3 months, right? Same condition, totally different treatment plan. So we need to understand that every single patient we take care of, everyone, no matter what they're suffering from, is going to need a different level of care. And it is never, ever, 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 ever up to the CNAs to figure out what that care is going to be. The nurse has to evaluate the patient, identify the needs, and write up a plan. We call that a care plan. And then the CNA's job is to read that care plan and follow it because it was made specifically for that person, that patient. So the nurse figures out what the patient needs, writes up a plan. The CNA reads the plan and follows it. And that CNA, the role of the CNA, no matter where you are, that is the role of the CNA. So now, if we think about my videos, there is no way that I can do a video that covers every single possible scenario that you might come into contact with in your career. There's just no way, right? So this patient can't put weight on their left leg. This patient can't put weight on their right ankle. This patient doesn't have a left leg. This patient is unable to support their weight on their arms. So there would literally be thousands of transfer from bed to wheelchair videos if I tried to do that, because every single one is different, right? So as a CNA, your job is to read and follow the care plan. And if you don't understand it, then you would need to get with the nurse to get clarification, because the nurse is the one that knows that patient the best. So I see these comments on my YouTube video quite often that, well, I'm trying to learn how to do this and she's not showing it. Understand that you can't learn how to care for a specific patient by watching YouTube videos, because those videos are not based on that specific patient. That video is based on this patient, right? So we have to be really careful. If we don't know how to do something, when you're a CNA and you're out there working and you're assigned to do something and you don't know how to do it, you didn't learn it in school, you go to YouTube, you pull up a video and you watch the video, understand that video is not going to help you because it's not based on that patient over there. You need to go to the nurse. Don't rely on YouTube. YouTube can be very, very helpful, but don't rely on YouTube to teach you how to take care of that specific patient over there. That's what the care plan and the nurse is for, because those are the only ones. Those are the only places that can tailor the process specifically for that person. So I really hope that helps you guys, particularly those of you that are looking maybe to care for loved ones in your home. And this is becoming very, very common. Patients are being discharged home because either they can't afford long-term care or the benefits have run out, or in a lot of cases, there's just no room. So family members are having to step up and do these tasks that maybe they're not comfortable with. Please make sure that if you're using our training videos for those purposes, they can be a good starting point, but they will never replace actual instruction that is based on that patient's specific needs. So I really hope that helps. All right. So Emma says, hi, Miss Patty. I love you and I'm grateful for everything you do for us CNAs. Oh, thank you. I appreciate that. And Mary tells Jesus, I encourage you to get vaccinated. Our patients deserve to be kept safe by healthcare workers. And I understand this is a very hot button issue. Everybody has their own stance on it. And I do understand both sides. Trust me, I do. I understand both sides. And you have to make the decision that's right for you. But remember that if you're going to work in healthcare, right, there's a higher level of understanding that we need to employ here. It's no longer just about us. If you decide not to get the vaccine for you, that's your right and your decision. And that affects you and your household and the people you come into contact with. But if you're working and you're employed in healthcare, then there's another level involved here. And our charge is to keep our patients safe. So sometimes that means safe from us. So if you make the decision not to get vaccinated, that may, it may alter your ability to work in healthcare, because unfortunately that puts your patient at risk from you. So I hope you understand, and I hope that I this is a very, very tricky subject, because a lot of people get really, really upset about this. And I am pro-choice. I do believe everybody has the right to choose, but you're not immune from the consequences of that choice. So just remember, you can make the choice that's right for you. And I heartily encourage you to think about whether the choice is right for you. But there are always consequences that go along with whatever choice you make, whether it's to get vaccinated or to not get vaccinated. So I hope that helps. All right, guys. Well, that brings us to the end of today's session. I'm going to be working on something kind of new and exciting. We're going to hopefully be live streaming these sessions on my website and on my Facebook page. So if I can get this hooked up, and this is like way beyond my comfort level, but if I can get this hooked up, hopefully you'll be able to join either through my website, so it'll be on the front page of my website, or through my Facebook page, to kind of keep your eyes open. It might be an easier way for you to join these sessions. And if you haven't before now, make sure you like and subscribe and ring that little bell on YouTube. And that way YouTube lets you know when I go live. That way you don't miss the session. But I'm trying to make it easier for people to find us and to join in. And if you've got some friends, bring them along next time. Cindy says, do they hire CNAs in Florida for home care? Oh, yes, they do. Home care is the number one hiring employer for healthcare in Florida. In fact, on my website, foryourcna.com, if you're in my my geographic location, like north of Tampa, I just did a whole page on all of the healthcare employers in our community. And when you click on it, it takes you right over to their page. It lists all of their open positions, and you can apply right online. It took me 3 days to put this together. And it's only for my geographic locations, because I did it more for my classroom students, but you guys can go check it out. But yes, home care, if you go onto that page, you'll see there's hospitals, there's nursing homes, there's assisted living, and then there's home care. It's a whole great big list. So lots and lots of opportunities out there for home care. So feel free to check it out. All right, guys, you're very welcome. Thank you, Jennifer and Suzette and Cindy. Thank you guys so much for tuning in. You're what makes my week. I love hanging out with you guys every week. So until next time, I'll see you next week, Thursdays at 3. Happy caregiving.